you everybody for joining us tonight for our Smilo Share series as part of our National Cancer Survivors Day celebration month. My name is Javin, and I'm here with the Smilo Cancer Hospital survivorship team. Thanks again for joining tonight, and we hope you've enjoyed the series so far. There's been some great talks so far. In the first of the month, some discussion about late and long-term effects from cancer treatment. Then last week on young adult survivors of cancer. And this week we're going to be highlighting fear of cancer recurrence, and we hope you'll stay with us for the upcoming topics the rest of the month too. So I just want to take a moment to thank everyone again. I'm going to share the screen here just so you know who we are on the screen, and I'm going to give everyone a chance to introduce themselves in a moment. Just want to remind everyone too, this will be available and is being recorded after the session. In addition to that, you can type in questions and answers into the chat and into the Q&A section. We're going to try to keep things fluid, and as best we can as we go throughout our short presentation today, we're going to answer some questions and answers and then save plenty of room for discussion after as well. So again, welcome everyone, and I want to let everyone introduce themselves here. Again, my name is Javin. I'm the physician assistant with the Yale Survivorship Program. Glad to be with you here, and we'll go down the line. Next, go ahead, Maura.
Hello everyone, and welcome. My name's Maura Harrigan. I'm the registered dietitian on the team. I'm board certified in oncology nutrition, and I really look forward to your questions. That's what we're here for today. It's an important topic. And I'll pass it on to Scott.
Scott, I don't know if you're still muted, if you can go ahead and unmute yourself.
Hi, everybody. I'm Scott Capozza. I'm the physical therapist part of the survivorship clinic. I've been here since the clinic started in 2006, and I get to work with all these amazing professionals side by side to help provide this multidisciplinary approach. So I'm happy to be here tonight.
All right, go ahead, Angela.
Hi, everybody, and welcome. Thank you so much for joining us. My name is Angela Khairallah, and I am the clinical social worker with the Yale Cancer Survivorship team. And I'm having some technical problems. As you can probably see, my video is very poor. So I'm going to turn it off, so you'll just be hearing my voice. So I greatly apologize for this inconvenience, but thank you so much for joining us tonight.
All right, thanks so much, Angela. And again, thanks everyone for joining us. We consider you a part of our team tonight too, and we hope you get something out of it. So without further delay, I'm gonna jump into the presentation here and hand it back over to Angela to start on fear of recurrence. And as I have control of the slides, just for my team, if you can just let me know to advance to the next slide, that would be great. Thank you. Go ahead, Angela.
Okay. Oh, yeah. Thank you so much, Javin. Again, this is Angela. I'm the social worker in the Cancer Survivorship Clinic. And for tonight, those of you who are listening in the audience, some of you may or may not know, but fear of cancer recurrence is when you're experiencing worry or fear that relates to the possibility that your cancer will come back or even progress. And among all of you, it is one of the most commonly reported
Angela, I'm so sorry.
With you. I'm sorry?
I'm just going to step in for a quick second. Your audio is quite choppy. I don't know if there's a way to try to move a little bit or maybe move closer to the mic. I know it's a hard connection.
Okay.
No, it's actually gotten worse. Oh my gosh, forgive us for that.
Me now? Does this sound okay?
That sounds a lot better now.
Javin, can you hear me?
Can hear you.
Okay.
Yes.
You know what? Okay, I'm gonna just hold in this position. Please, you can hear me now?
Yes, loud and clear.
Okay, I'm just gonna hold my phone in this position. Sorry,
Well,
you
it's
guys.
returned to the bad audio again.
Okay,
Angela,
so again, the majority of the patients that I see in
Angela,
our
what I'm gonna
survivorship clinic. Okay, thank you.
what I'm
The
gonna
majority of
do.
the patients that I see, most of you experience some level or worry that your cancer can come back or progress.
Angela, can you
What
hear
I
me?
want to emphasize.
Okay, it's still happening and you're cutting in and out quite a bit. So what I'm going to ask is maybe if you can try reconnecting in just a moment, and we can actually, jump ahead maybe a little bit in the slideshow and return back to this part so we can just keep things moving. And okay.
Yes.
Okay, sorry about that. And I appreciate that. If you can try jumping back on, maybe just on the phone and audio. Thanks for that. All right, so I'm going to move ahead in the slideshow here. And we're going to come back to Angela in just a little bit, and forgive us for the technical difficulties here. She'll go into a little bit more detail about fear of cancer recurrence. But I'll just say here, the name in and of itself is fairly self-explanatory in that it's the fear that one's cancer could come back. And it is very common among cancer survivors. It actually occurs statistically, we see about 50 to 70% of survivors, but as a survivorship clinic, I'll say we see it often coming back, into our clinic, people bringing this up quite a bit. So fear of recurrence can occur at any stage of disease. It doesn't matter if you have a higher stage of cancer or even a non-invasive form of cancer. We see this from everyone coming through. And so it's a common topic that we see, and it's important to be bringing that up during a visit as it's not something that's always discussed. So I want to encourage everyone here that in a visit with a provider from your oncology team in particular, don't be afraid to bring this up if it's something that's been on your mind or bothering you. And there are some interventions that have looked at ways that can reduce fear of cancer recurrence and improve communication about it, such as some electronic interventions that have been instituted by nurses, as well as some other therapies as well, such as cognitive behavioral therapy. But those are some things to consider depending on your level of fear of cancer recurrence, which Angela can talk a little bit more about in just a bit. So there are some key takeaways when we're talking about fear of recurrence. First and foremost, you got to bring it up. I can't tell you how hard of a topic this is to bring up, or maybe you would be the better people to tell me, because again, among cancer survivors, it's so common. But if providers don't know that this is on your mind, it may not be asked. And so it's important to discuss this with your providers, whether in your oncology follow-up or with primary care even. It's a normal experience for survivors to have. It happens in almost all cancer survivors, definitely in a vast majority. And it can certainly be a barrier to daily function, to sleep, and that's when it's important to discuss recommendations for managing that, because that's when there may be more moderate or severe fear of recurrence. And that's when it's time for professionals to step in, such as mental health counselors, if you might be open to that, to come in and talk about that. And really talking about fear of cancer recurrence can help reduce stigma. And what does that mean? So there are a set of certain stigmas that can come up with cancer, and discussing fear of cancer recurrence and what that might mean to someone. And someone might feel guilty for feeling that way, such as, well, why am I still feeling this way after I finish my treatment? I should be feeling better. It can be difficult for people to have this sort of emotion. And our goal as a clinic is to help recognize that, acknowledge it, and normalize it, because it's okay to feel that way, and it's okay certainly to discuss it and reach out when you need help about this. And really, it's about staying informed as well to help reduce fear of recurrence. So there are a number of things that can be discussed during a visit to help really take away any uncertainty you might have, whether it's discussing your diagnosis, discussing concerning signs or symptoms for cancer recurrence if you're unsure about that. Talking about behaviors that you can be taking to help reduce your risk of recurrence, such as some healthy lifestyle behaviors, like avoiding smoking, limiting alcohol, exercise and physical activity, or following healthy nutrition. And, another thing that can be confusing sometimes is the follow-up schedules and the surveillance schedule for looking back to see, is there any recurrence on imaging or lab work, any signs or symptoms of that. And so discussing that with your oncologist is important to know when you should be following up and why you should be having imaging or labs when you should be. All right. So I'm gonna take a moment here, and I apologize for sort of backtracking. Angela, are you back on with us?
So I'm in my car.
Okay.
So hopefully this will work. Is it better?
It's a lot better. So I'm gonna go back in the slideshow.
Fantastic. Sorry,
back to
everyone.
your part.
Okay.
Okay.
Yeah,
ahead,
okay,
Angela.
let me, and I'm on my phone, so hold on, I gotta swipe to find the PowerPoint, hold on.
Thanks
All
everyone
right,
for bearing
okay,
with us.
okay, we're back. So I don't know what you guys heard, so I'll just quickly, yay, you can hear me loud and clear. Great, Stephanie. Okay,
Angela,
so
I'm
fear of
actually-
cancer recurrence.
Forgive me, Angela. One
Go
question
ahead, Javin.
came in, and I wanted to address it because I did mention
Go ahead.
fear of recurrence being a common thing among survivors. And someone asked, if it's so common, why don't providers assume that it would likely be an issue? It's a great question. And it's certainly something that is on our minds, but unfortunately during follow-ups, routine follow-ups, certainly with your oncology team, it might not be something that time allots for during the visit. And if it's not brought up by, the person in the visit, then a provider might not know to ask about it in that time as well. It's certainly important to bring it up, though, if you are experiencing fear of recurrence, and should be acknowledged. And as a survivorship clinic, we see that discussed in our clinic often. So you can certainly come to see us to talk about that, but additionally, feel free to bring it up anytime in your visits. Okay.
Okay, thank you, Javin. And so that kind of is a good segue into leading in. As I was saying, the majority of the patients that I talk to, that I see within the cancer survivorship clinic, are experiencing some level of fear or worry that the cancer could come back or progress. And as Javin was indicating, it's very normal and quite common among cancer survivors. Okay, so what we know is it affects between 50 and 70% of you across all different types of cancer, and it really is one of those unmet needs that often goes, like what Javin had said, not asked about sometimes. Next slide, please. And so, one of the things about fear of cancer recurrence is that there can be levels to it where it can really encourage positive health behaviors, kind of, what Javin was also discussing in a previous slide, and we know that, the level that you experience is not strongly linked to your prognosis, and can even occur in people who have a relatively good prognosis, or even a very early stage of cancer. So really, there's, it doesn't really necessarily matter your stage or the type of cancer. Next slide, please. And so one of the things that we also know, there are some risk factors that might put you at a higher risk of developing fear of cancer recurrence. So we know that if you're a younger cancer survivor, so, adolescent, young adults, the AYA population is anyone between the ages of 15 and 39 who gets diagnosed diagnosed with cancer. We also know that women are at a higher risk if you've had more severe side effects, if you have a past history of mental health issues like anxiety or depression or past trauma, or if you have relatives or multiple family members who have developed or died from cancer. That can sometimes put you at a more vulnerable risk of developing fear of cancer recurrence. Next slide, please. What we also know is fear of cancer recurrence can really fluctuate between functional and dysfunctional anxiety and can really impact all areas of your life. It can cause psychological distress, sleep issues, issues with concentration and focusing, excessive reassurance from healthcare providers. And in extreme cases, patients can develop anxiety disorders, depression, and even post-traumatic stress symptoms. Next slide, please. So what we know about fear of cancer recurrence, so when I'm meeting with patients, part of my role is to talk to you about just how you're doing overall emotionally. And when I meet with patients, you're not only dealing with the fact that you had cancer, but also the impact that cancer and cancer treatment may even still be having on your life. When I talk to you about fear of cancer recurrence, so there's different levels, and there's mild forms where you might think about it sometimes, occasionally the thought comes in your head, but it really is triggered by something externally. So maybe a follow-up appointment, or you hear of a family member or a friend getting diagnosed. A really common one that I hear about is if you've had breast cancer everywhere, for the month of October. But generally, this mild form, it improves over time. And for the most part, you seem to be coping in severe to moderate form. This would be when you're thinking about it several times a week, but there isn't a trigger to explain why you're thinking about it. So the thought just kind of comes in your head and you don't know where it came from, but it's difficult to control those thoughts. And it causes quite a bit of distress because it's hard to control them, and then it's hard to get rid of them. And then you're noticing that it's impacting your life. So your ability to focus and concentrate, your relationships, maybe you're having a hard time eating or sleeping. So it's getting to that level. Next slide, please. And then when you're experiencing it more of a severe or highly disabling, this affects approximately 7%. You're experiencing constant intrusive thoughts, and you have this preoccupation that your cancer could come back regardless of your prognosis or the stage. And you might overly monitor for cancer signs or activity, and it's actually impacting your daily functioning and impacting your quality of life. It might be you might either seek medical attention often for reassurance that the cancer could have come back. It's not uncommon for patients to be concerned if they have an ache or a pain or a headache or a bruise that they can't explain where it came from. Or maybe you're on the opposite end where you're so fearful that the cancer could come back that you're actually avoiding coming to your medical providers. Or you might engage in unhelpful coping strategies. Another thing that can be quite common is you're fearful to even plan for the future. I've had patients say to me, I don't know if I should buy this car, or I don't know if I should buy my new house, because it's hard to plan for the future, because what if it comes back? And it's difficult for these to go away unless you have some type of clinical intervention. Next slide, please. And so the clinical intervention that I'm talking about is if I'm meeting with you and you haven't already been seen or experienced coming to a cancer survivorship clinic, I will encourage you to come to one, depending on where you were treated. But often I will refer you to seek mental health counseling from a clinical social worker or a psycho-oncologist, or maybe even a psychiatrist. And we know one of the best form of treatment for anxieties and fears and depression is something called cognitive behavioral therapy. And I believe that Javin also alluded to that. Another thing that can be helpful is, seeking support through a cancer support group. But we also know that engaging in these positive, healthy behaviors like exercise, regularly eating, yoga, all of those things can be quite helpful in helping us cope. Next slide, please.
All right, thanks so much, Angela. Appreciate that. And we've gotten a flurry of questions. You're welcome. And we've gotten a flurry of questions that have come in. So I wanted to get to some of these. First one here that I have, and Angela, I think this would be a good one for you. I have asked for help with overall mental health and have not received any referrals except one who was awesome but not a regular counselor. So it's, it's not in a question per se here, but it sounds like there's some struggle with, referrals to see someone who can help with, mental health counseling. Well, do you have any advice for someone in such a situation?
Absolutely. The first thing that I would do is, depending on where you're treated, almost always there's going to be a social worker connected to the clinic in which you were treated. So you could first ask to speak with that social worker who could provide you with mental health referrals. The other thing is that your oncologist may actually have people that they could refer you to. Another avenue is to ask your primary care physician if they have any people that they could refer you to. Sometimes even just going through your insurance provider, they can provide you a list of people who can offer that level of support to you as well. And there's, just kind of Googling, there's a variety of websites and searches and things that you can do out there, and different search engines that you can find mental health providers.
Okay, great, thanks, Angela. And I'm not sure if we lost you, you froze up a little bit there. No problem. So the next question we had here, providers won't really give any assurances or statistics about recovery or odds of recurrence. They stay very neutral about any future predictions. We are left to do our own research. Can you recommend any resources for published statistics about recurrence rates? I think this is a great question, and it's something that I see a lot of people asking in our clinic too. Part of the survivorship program's strength is that we go through a survivorship care plan, which goes through your individual diagnosis. And, and part of that can also be the prognosis as well, the likelihood of recurrence. The difficult thing with giving a broad recommendation to say, oh yes, go to this website, look at recurrence rates, is that everybody's cancer is individual. And so while you can certainly go to a website or look at data for a cancer type, it's important to discuss with your oncology team, because there could be characteristics about your cancer that might impact your recurrence rate. And it's a good question to bring up and ask for more specific information if that's what you're seeking, to know a little bit more and understand where you're at. So it's a great question. I'm sorry I don't have a specific answer for you here or resource, but I would encourage you to talk with your oncologist and voice that concern. All right. We had another question here. I have read about new treatments for PTSD, depression, and addiction that include use of MDMA or other psychedelics. Do you offer any such treatment for cancer survivors or victims? So Angela, I don't know if you had any thoughts on this and wanted to jump in too. I'll just give my quick 2 cents at least. We do prescribe antidepressants for people who have more significant anxiety or depression. It can certainly be tied to fear of cancer recurrence. And that's something we can offer to help with that. As far as, psychedelics and some of the research going into that, we don't use that as routine treatment for anxiety and depression right now. You know, I think we still need to see where that sort of research goes and what dosing would be appropriate and so on, if that becomes a viable option. But we need to see where that ends up first before we go down that path. But for now, we do prescribe antidepressants and sometimes anti-anxiety medications as needed. But it's important, if you're thinking about that, to talk with your team about it and ask what would be best for you. Angela or anybody else, I don't know if you had any other thoughts on that question.
No, you answered it perfectly.
Great. Sure. All right. So we have a large number of messages coming in the chat. I think in an effort to get through some of the presentation, so I'm going to transition back. So I'm going to go back to Maura here to talk a little bit about nutrition with regards to fear of cancer recurrence.
Thank you, Javin,
Yeah.
and hello, everyone. So, you know, this fear of recurrence, next slide, Javin, can actually become a fear of recurrence, can actually turn into a fear of food for many people. Because where I see this coming from is people will say, maybe it was something I ate that caused my cancer. Maybe it was something, maybe there's something I will eat that will cause my cancer to return. You know, it's really that unknown and that kind of lack of control over the situation. And I think that's what drives a lot of the fear, is this lack of control over the situation. And what I'd like to address this and say, food shouldn't be feared. Food is something that you actually can have control over. And there's actually many positive things that food can do for you. So I'd like you to think more as food is your ally rather than something to be feared. It can be actually be very helpful. So next slide. So one part of this question is always that you hear this, you've heard this a lot probably, does sugar cause cancer or does sugar feed cancer? And I just want to be very clear about that. And the answer is no, it doesn't. But should we be limiting the amount of sugar in our day-to-day eating? Yeah, yes, absolutely. Why? Because there's so much sugar added to our food supply that's unhealthy for us just in general. So you're allowed to have sugar. We enjoy sugar. It tastes good. It's meant to be enjoyed. But there's a healthy amount to have. And I quantified that at the bottom of this slide. And I kind of phrase it different ways. It's either by calories or by grams, because that's how it's listed on the label, food label, or in teaspoons. So you can see it's a little different for women, and men always seem to get a little more, which is always unfair to me. But I just want you to know you can have your sugar and enjoy it. And next slide. Now, another area that is driven by fear of recurrence, I think, is people are more prone to turn to dietary supplements rather than food as a way for cancer prevention. And I want to be very clear about this, that dietary supplements do not prevent recurrence of cancer. And we recommend that you use whole foods to obtain these micronutrients, not dietary supplements. And this is actually clearly stated by the American Cancer Society, World Cancer Research Fund, American Institute for Cancer Research. All these robust bodies have weighed in on this, and it's clear. The thing is, dietary supplement use is quite high among cancer survivors. In the general US population, about 50% of healthy adults use dietary supplements, often unnecessarily. In cancer survivors, it's 70%, even up to 80%, it's been reported. So this is a common place to turn when you're trying to deal with your fear of recurrence. And I'd like to steer you away from that and bring you back to whole foods. Now, there's a myth out there, well, if some vitamin C is good, more must be better. And That's not true. Micronutrients in these dietary supplements are meant to be used in small amounts, and the amounts that are present in natural foods are just what we need, right? The thing is, you have to understand that this is a big business out there, and the dietary supplement industry is huge. And by 2024, it's projected to be $300 billion. So there's a lot of, so they're presenting it as this is a good thing to have and more is better. But in terms of managing your health, the opposite is true. Next slide. And a key part of watching how we use dietary supplements is people don't realize that supplements act differently in your body than food. Actually, supplements act like prescribed medications in your body. Your body handles them the same way. So these dietary supplements you're taking can actually interact with the prescribed medications that you're taking to prevent cancer. We recently published a paper, and we showed that we had about 475 breast cancer survivors report their dietary supplement usage. And we found that 40% of the women who were taking tamoxifen or aromatase inhibitors were taking supplements that interfered with those medications working. So that's why it's so important that you report your dietary supplement usage and herbal preparations, you know, just like you report your medications to your doctor, and that has to be reviewed because we don't want that. Yeah.
Maura, we have a great question here. Don't certain supplements, though, help to build the immune system, which helps cancer from coming back?
I'm going to say no. The primary driver from a nutrition standpoint to build your immune system is the dietary fiber that's present in fruits and vegetables and whole grains from your plant foods. The dietary fiber is what I call Mother Nature's prebiotic, right? It's and the dietary fiber is used by your body, your body's own microbiome, to manufacture the gut flora that it needs to balance it out. So the strongest nutrition support of your immune system is the amount of dietary fiber in your diet. And we try to get at least 25 grams a day, which is hard to do. Any other questions?
Oh, no, and forgive me, I was advancing the slide.
That's okay. So that was a great lead into, so focusing on, so instead of worrying about what are the bad foods to avoid, let's focus on what are the good foods to include. So we focus on our colorful fruits and vegetables, and the power is really in the color. So it doesn't matter if it's a fruit or a vegetable. What matters is the color. And the colors contain what we call phytonutrients. Nutrients, phyto meaning plant, nutrients only found in plant foods. And you can see this is just a partial listing of the names of these compounds. So different clusters of these phytonutrients actually create the color in the food. So if you think of food that way, if you capture all these colors in your week, you can see it's purple and blue, green, yellow, orange, red, white. You capture these colors. These are the compounds that actually interfere with the development of cancer in your body. They can slow it down. They can actually interrupt it. Right, so I want you to think in terms of your eating, where can I add a color? At every meal. It's that simple. The more color, the better.
Or we have another great question here. Sorry to interrupt, but they just keep coming in. Natural foods, fruits and veggies are often GMO. How can we ensure we are eating complete whole foods?
Oh, great question. There's a kind of a mashup there. I'm going to say something that a lot of you will probably find controversial, but GMO foods, which means genetically modified organisms, are actually safe to eat. and do not promote cancer. Okay, so there'll probably be more comments in the chat room because of that, but I'm trying to be very clear about things. Most people don't realize that GMO seeds have been in use for about 30 years. And I think in the supermarket now, if you go into Stop and Shop today, there's about 50,000 products in there that actually have GMO, started with the GMO seed in it. So you do not have to eat GMO free to prevent recurrence. So I'll leave it there. I know that's a big one.
Yeah.
Any other?
We did have a few. We're getting a few about using supplements per provider's recommendations when they're recommended by their oncologist. What should people do in that scenario then?
Okay, that's a great point. So when I talk about dietary supplements and herbal preparations, you can buy these over the counter, and a lot of people just go in and just start taking them. But if you're in conversation with your oncologist and they're recommending a particular supplement, that's coming from a better source. So you want it to be informed, and you can have a dialogue about that. I would, as a dietitian, my first question is always, well, what are you eating? And let's see if we can improve the quality of your eating and the nutrient density. Let's start there before we start adding supplements. But your physician may have a very specific reason to recommend a supplement, and you would want to ask them about that. And oftentimes it's to replace a deficiency in the diet or a deficiency they may have in your workup.
And Maura, one more, if I can ask this of you, because it's been popular as well here. What about soy and breast cancer?
Okay, that's a great question. That concern about soy has been one of the most persistent issues that that comes up in nutrition counseling for breast cancer. And here's another controversial statement. Soy is safe to eat, and actually soy is considered helpful to prevent breast cancer from recurring. So that's often quite different from what people hear. Initially, that the story about soy goes back a way when, as we were finding out that there are hormonally sensitive types of breast cancer. And so the question was, and then they developed these medications, tamoxifen and aromatase inhibitors, which interfere with estrogen in the body. So then the question was, well, what about the estrogens in plant foods? So it was a logical question to ask, and it was asked and it was looked at, and it turns out that the estrogen in plants acts differently. It's not the same as the estrogen in your body. And it actually, the estrogen in plant foods actually bind to estrogen receptors in breast tissue and actually prevents your body's own estrogen from binding to the breast tissue. So it's actually kind of a adjuvant help. So I know that's kind of a very different thinking from kind of that old, but soy information, that it needs to be updated, and we need to get that word out there because a lot of women worry unnecessarily about it.
Sure. Well, thanks for all of it, fielding all of those questions, Maura. I think people got some valuable answers out of that. So appreciate that. And we'll get back to the presentation now in here. And I'm trying not to forget people's questions. We can certainly circle back, okay? Thanks, everyone. Let's see if it's gonna work for me. There we go.
Okay, so I'm just trying to give you some practical information. So when you go food shopping, and again, I'm trying to make this visual, but look in your cart. Do I have all my colors in my cart? This is something I do when I food shop. And here's some more interesting news. The fruits or vegetables, they can be frozen. They can be canned, right? Frozen and canned actually have a higher nutrient content than fresh. All right, let that sink in. So, but if you buy fresh, local, in season, at your local farmer's market, okay, that's where you get more nutrient content than frozen or canned. But so eating this way can be very economical by using frozen and canned fruits and vegetables, and then buying fresh local in season. And here's another statement: it does not have to be organic, okay, to prevent cancer. So I say this because most people feel like I can't afford to eat this way. I can't afford to eat organic fruits and fresh fruits and vegetables. And this is the to say, yes, it is affordable because it can be frozen, it can be canned, and it does not have to be organic. Okay, next slide. This is one of my favorite summary statements of how to eat well. Eat food, not too much, mostly plants. This really kind of sums it up. And next slide. But I want you to remember this: it doesn't have to be perfect. You don't have to eat perfectly 100% of the time. I have what I call the 80-20 rule. 80% of the time, you kind of want to be on your A game with eating well, being mindful, incorporating colors, making sure you're getting enough dietary fiber. 80% of the time. Then you have the 20% of the time where, you know what? Eat what you love, eat whatever you want, right? It doesn't have to be perfect 100% of the time. And as my team here will tell you, my 20% rule, they could tell you, it includes jelly donuts. That's kind of my, that's always my go-to. I need a jelly donut, yeah. So everyone breathes a sigh of relief when they see the dietitian chowing down a jelly donut. And I'm like, this is my 20%.
That's
So
how
again,
we know we can join in.
That's right. So, just remember, food is meant to be enjoyed. And it's meant, there's celebratory foods. Food's delicious, and food is your ally. And again, food can really support you in supporting your immune system and just keeping good energy levels and moving forward in wellness. And I think this is where I can answer more questions, but this is the end of my slides, and Scott will be up next.
I want to take a pause there. We've been staring at a presentation screen for quite a while. I'm gonna take a quick look here. There were a few questions that came in. Maybe we'll get in one or two before we can get to Scott here next. So let's see, there was one in the chat. Can foods that cause inflammation like dairy contribute to fear of cancer recurrence?
Oh, that's a very, there are lots of pieces to that question. Great question. So first of all, it brings up the question of inflammation in the body, which is something we want to reduce, right? And we show that, again, I'm back to your colorful fruits and vegetables, and your dietary fiber are actually shown to reduce inflammation in the body, as does exercise and achieving a healthy weight. So I wouldn't put my finger on dairy for that, okay? But inflammation is a factor, but that reducing inflammation is done by incorporating more plant foods into your eating plan. And Scott can address the exercise piece of it. Dairy is one of those things that's kind of controversial. I think it's, in terms of cancer prevention, it seems that dairy may have a role in prostate cancer, but it's more excessive intake. It doesn't mean you can't have dairy. 2 servings of a skim or low-fat dairy is still considered safe. Remember, dairy, it contributes protein, contributes calcium, and maintaining bone health is an important part in cancer survivorship. And I just saw that one. Yes, yogurt is considered dairy, and yogurt is an excellent food It has some of the cultures that also support the gut microbiome. It has the calcium. And I would recommend that you get it plain because that has less added sugars, and you get the skim or low fat version.
One more here for you, Maura.
Okay.
But isn't eating non-organic exposing us to pesticides, herbicides, hormones, etc.?
Yes, but at what level? You know, it comes down to dose. And so what's most important is, one, safely handling your produce and your foods by properly washing them before, in part of your preparation before you cook them. So cleaning them is really important. Good food safety kind of trumps that. And it would be doing that, the exposure levels are considered to be safe.
Great. Well, thanks, Maura, for fielding some more questions there. Appreciate that. And I think we can move on to Scott's part of the presentation here next. So I'm going to share the screen again. And Scott, turn it over to you.
All right, thanks. Can you hear me, Javin?
Can hear you loud and clear.
All right, awesome. Yes, and I definitely do follow Maura's 80-20 rule. And yes, we would intentionally center through the lunch line whenever we would go to conferences as a group. We always center through the lunch line first. And yeah, she got that chocolate chip cookie at the end of the line. She always had her greens, and she always had a well-balanced plate, but the chocolate chip cookie was in the corner. And so that gave us a license to get the chocolate chip cookie as well. But while we were at these conferences, we would also say, well, let's explore where we're at. So let's get some exercise in. And so if we talk about fear of recurrence with respect to physical activity, as we move on to the next slide, it's important for especially us as rehab professionals to understand where you're coming from, right? We need to not just tell you that it's important to exercise. We need to know who you are and where you're coming from, because there are definitely, you may be one of these people who, you never exercised before. And exercise is a scary word. And so how do we put together a program of moving forward that's safe and that is doable for you? But I also see a lot of individuals who say, well, I thought I was doing all the right things. I thought I was eating well. I thought I was exercising. I was going to the gym, and yet I still got cancer. So, there's this sense of that their body kind of betrayed them. And so they may ask the question, well, why bother doing exercise now? It didn't work for me before. Why do it now? Or people will say, I want to get back to exercise. I want to get back to the gym, but I don't know what's safe. I don't know how to move my body now that I've had surgery or I've had chemotherapy or radiation. So that's where, having a rehab specialist as part of a multi-D clinic is so critical to address these questions. So, Javin, as we move on, in 2019, the American College of Sports Medicine updated their guidelines for exercise recommendations for individuals with cancer. And this update was great because it was a lot more personalized than the original recommendations that came out in 2010. And it helped give us as rehab professionals guidance as to what kind of exercise and the dose and the frequency of exercise based on what people are presenting to us. And so with relevance to tonight's discussion, I thought it was really fascinating that we now have research that shows that exercise can help decrease anxiety and depression that's related to a cancer diagnosis, which can lead to this fear of recurrence. And so we didn't have that research in 2010, but now we do. And so now we have solid ground to kind of stand on. And I think it's interesting for me, if I'm advising somebody on what kind of exercise and how much exercise they should do, whilst right now strength training hasn't been shown on its own to help reduce symptoms of anxiety and depression, cardiovascular exercise on its own does. And it actually, it's recommending that you do more cardio than actually if you're experiencing cancer-related fatigue. But if you put them together, you get a much more well-rounded workout program. And so then as we move forward to the next slide, one of the other things that came out from those 2019 updated guidelines was that they talked about prevention and how exercise we now have the research to show that exercise helps prevent the recurrence of 7 different types of cancer, which is pretty amazing because we didn't have that information even 10 years ago. With respect to tonight's conversation, I feel like they buried the lead because way in the corner over here, they said also that for cancer survivors, incorporating exercise improves survival after diagnosis of breast, colorectal, and prostate cancer. And so I think that that's so important when we have this discussion about exercise, is that yes, the research is out there. Like, people have been doing randomized clinical trials and figuring out that exercise can help with the recurrence of these 3 cancers. And I'm sure when they do another update another 10 years from now, hopefully we'll see that there will be more cancers that will be proven that exercise helps prevent a recurrence. So if you put all of that together, you put moving your body and fueling your body and taking care of your mental well-being, and addressing all of your medical questions and concerns through a multidisciplinary approach, that can help with individuals experiencing fear of recurrence.
I'm going to interrupt with a question for you.
Sure.
Great question. Does Smilo have an exercise oncology program?
That's a great question. So we have a physical therapist who is board certified in oncology physical therapy. That's me. We, however, don't have a specific exercise class, if that's what you're asking, for cancer survivors. And it's one of the many things that I'm trying to work on and to try to develop. So what I've been doing, especially during the pandemic, yes, a class would be fantastic. And what I've been doing, at least in the short term during the pandemic, is trying to direct people to, again, credible exercise programs that are out there. Because I definitely have seen people, or I've worked with people who said, oh yeah, I just went on YouTube and I looked up some exercises to do, but you don't know what that person's credentials are. You don't know if these are actually good exercises for you. This is not necessarily a personalized exercise program. So I have been able to vet different programs. Some are here in Connecticut, some are from around the country, but the beauty of virtual is that it doesn't matter where it's based out of and where you're located, you can log on. And in some ways, I actually think that these virtual classes can be good because it does help with setting a schedule and adherence to a program and a plan. So if you know that you've got to log on at 11 o'clock on a Tuesday to be part of this online yoga class that's being put on by physical therapists and yoga instructors that have experience working with cancer survivors, then you're going to log on and you'll probably be more consistent doing it that way. So that's actually a very long-winded answer to your question. That we have, yes, we have PTs and OTs who are lymphedema certified, and I'm oncology PT certified. But we don't have specific exercise classes as of yet.
Thanks, Scott. Appreciate that. All right. Were you ready for the next slide?
Yes.
Okay. And that's
actually,
it.
I think that was
that
it.
was the last slide. So I'll stop there for everyone. And I do want to get to some of the questions. Everyone's been lighting up the chat and the questions here. And first, I want to take a chance to thank everyone here for presenting their parts of the presentation too. We had some questions going back to some of the parts Angela had been talking about, and I think would be good questions for her. One, Angela, was, does Smilo in New Haven have breast cancer support groups?
Yes, we do. And it's virtual, of course, but we do have a breast cancer support group for any stage and any type of breast cancer. And we also have a metastatic stage 4 breast cancer support group. So if you're interested, I'm actually the social worker in the breast center as well. So if you're interested in that, I would be happy to give you more information about that. Javin, I guess you could post how to contact me in the chat, my direct line. And I'd be happy to answer those questions for you.
Thanks for that, Angela. And I have another one for you here. Maybe if you are in remission for a cancer that is expected to return, isn't vigilance, etc., expected? It seems like it's not possible to just have mild or moderate anxiety. So again, the question being, isn't vigilance, being vigilant about a potential recurrence, expected as part of fear of cancer recurrence?
Right, absolutely. But what I want to encourage you to think about is there's a difference between vigilance, right? Getting things checked out and making sure that you're okay versus having a level of worry or fear or anxiety that's impacting your quality of life. So that's very, very different. Okay. So somebody who's experiencing fear of cancer recurrence at kind of a moderate to severe level, it's when your worry or fear is really impacting your relationships, your ability to sleep, your ability to eat. You can't focus and concentrate. But, you know, a mild form of it, again, is when you think about it sometimes and, when you think about it sometimes and it comes in your head and, you know, maybe you do have a pain or something like that. Of course, you're going to want to go get that checked out. Of course, you're going to want to call your medical providers to make sure that you're okay. But again, it's when your worry or your fear is impacting your quality of life, and that's when it can be concerning, and it's helpful to seek some clinical help and support for that.
Thanks, Angela. Appreciate that. We're getting some other nutrition based questions here. Some thoughts on a few different specific things here, Maura. What do you think about beta glucan? And another question, aren't carotenoids bad and that they can promote cancer or lung cancer?
Okay, great. I was just typing an answer, but I'm pretty slow. Here we go. So great questions. Okay, so beta glucan is actually a type of dietary fiber. It's a soluble fiber. So it's readily available in your foods. So there's no need to take it as a supplement. Right? It's a part of, remember, supplements are very isolated, purified components as opposed to the food source, which could have hundreds of other components packaged along with that nutrient that enhances its absorption and utilization in the body. So beta glucan is readily available in fiber, in plant foods. I love that question about the carotenoids. That's what I was trying to type back. So good pickup. So there was a research study called the CARROT study that identified that dietary supplements of carotenoids actually increased risk of lung cancer. And they halted the study because of that and put out their findings. But that was carotenoid as, again, a dietary supplement, which acts like a medication in the body. What I was talking about is the carotenoids that are naturally found in foods, mostly your orange, yellow, and red foods. That's different than a dietary supplement. And actually, the carotenoids naturally in the food source reduce inflammation in the body. So that's, again, the difference between a supplement form of something and a food source of something.
Great, Maura. Well, I'm glad we could, answer that for everyone here too. So that worked out quite well. The slow typing paid off in some way. So I want to acknowledge for everyone now that we are an hour into the webinar tonight, the Smilo Shares event here. We want to respect people's times. We do see that there are a few other questions coming in, and I see some answers coming back from some of our panelists here as well, so I appreciate that. But if you need to go, we understand. We can certainly stick around for a little while longer to answer some of these questions that are coming in too. Just want to, again, be mindful of everyone's time. I have a question here for Scott. Scott, is upper body strength training safe with a port?
Yeah, yes, it is. Can you hear me okay, Javin?
Yes, can hear you.
Yes. Yes, exercising with a port is safe. Probably there's a few things to be mindful of. Probably the big thing that I tell people who have a port is to try to avoid any kind of impact directly on the port. To stay away from, sports, to say like lacrosse or anything like that where you could get hit. But to be able to do upper body exercises, yes, absolutely. And that's a big reason why coming in, for physical therapy, for these consultations and evaluations are good, because then we can design a specific program and be able to progress you appropriately through that. But yes, the overall answer is yes. I work with plenty of people. I work with women who have a port and they have their tissue expanders in all at the same time. I work with people who are currently undergoing radiation therapy. There are definitely ways around it to be able to get you to move. And even if we're working, on core strengthening and lower body strengthening, at least we're doing something. But we've been able to make adaptations to exercises while in active treatment to make it work.
Great, thanks for that, Scott. Another question maybe for Angela here with a thought, an idea. Is there any thought about organizing cancer support groups through Smilo at the different treatment locations or virtually? It would be nice to meet periodically with groups of survivors, and even better if the groups could be organized by cancer type.
Okay, so I guess we do have support groups for different types of cancers at some of the different care centers. But unfortunately, right now, all of our groups are by Zoom because of the pandemic. Unfortunately, because of the pandemic, it's really prevented a lot of that, face-to-face groups. But I think maybe you might be asking about groups specifically for cancer survivors, so patients who've completed. Excellent suggestion, so thank you for that. I hope, pray that we get to a point where we can start meeting face to face again, so that we can be able to have those groups available to all of you.
Thanks, Angela. Great point in that. Yes, we do have lots of support groups at Smilo across the network. And I did post a link there from Yale Cancer Center affiliated with Smilo about those patient care groups as well. So let's see here.
I'm going to jump in here. I saw a couple of questions
Thanks,
that
Maura.
I can kind of answer. Someone said that after their treatment, they found they developed a sensitivity to fruit and to sugar. And is this common? And the answer is yes. The treatments can cause particular taste changes and taste sensitivities. So that's considered normal. It should abate over time. But if you find that you can't tolerate fruit, remember, it's the colors that matter. So oftentimes, if you can't tolerate fruit, you can tolerate vegetables. So the colors and using the colors as they apply to the vegetables, you'll still take in those nutrients that you're looking for. And someone also talked about how their mouth was very sensitized after treatment and had difficulty eating because of that, and gravitated towards unhealthier foods, probably something like Pop-Tarts. That seems to be a common, go-to food for a lot of people. What I would recommend there is, and we use this in one of our studies where we do nutrition during active treatment, and we do a lot of soups and smoothies where you blenderize the foods, and that texture, that kind of soft, smooth texture, is more tolerable. It's easy to, you don't have to really chew it, you just have to swallow it. You can put in a lot of nutrient-dense, colorful fruits and vegetables. We have great recipes for that. If you want to reach out to me, I can send you those. And what triggered that to me was someone else asked about, what about adding a protein powder to a fruit smoothie? And that's a great idea. It's that concept. You could do a fruit smoothie with protein powder. And that's a great way to get in these phytonutrients when you really don't feel like you can chew or swallow, or food's not really appealing to you. I would like to point out that the best protein powder out there is powdered dry milk. Very, very inexpensive. So you don't have to go for kind of expensive powders, protein powders. The good old powdered milk does the job. So I hope I captured all that, all those questions for you.
Thanks, Maura, for that. And yes, it was like you were reading my mind, because those are the ones that I was actually going back to look for, because I saw a theme happening here too. Yeah. So that was great. We had another question. Does alcohol increase the probability of reoccurrence? And yes, alcohol, I can certainly take this, and Maura, I'm happy to have you jump in here too. Alcohol does, is a risk factor when, abused, when drank in excessive amounts. And so the recommendation as it stands from the National Comprehensive Cancer Network is 1 drink a day for women, 2 drinks a day for men, but that should not be applied necessarily entirely universally, and it can be dependent upon your cancer type. So I want you to always go back and talk with your oncologist if you have a question about alcohol use, or having occasional or sparing glasses of alcohol or beverages with your oncology team before you can safely say, yes, I can just partake in that. But generally, again, the NCCN recommends 1 drink a day for women, 2 drinks a day for men. However, there could be some change in some of that verbiage in the future. And generally, I would say sparingly, special occasions, holidays, and talk, first and foremost, talk with your oncology team about if that would be appropriate for you. Maura, I don't know if you had additional thoughts on that.
Just to define moderate drinking, just so people are clear on that, it's 1 drink a day for women and 2 drinks a day for men. And a drink is defined as 5 ounces of wine, 1 ounce of a hard liquor, or a 12-ounce beer. Those are all equivalents in terms of alcohol content. So just as a point of reference for people.
Thanks, Maura. That's a great point, because it's easy to say a drink, but a drink might differ from one person to another, and what that's defined as. All right. Just trying to see if there was any additional questions here. Nothing else that I think has come in. So I'm happy to end it here. And I want to thank everyone for sticking with us for this almost hour and a half long Smilo Shares session for our National Cancer Survivors Day month. We had a great discussion with everyone, and thank you for all the questions on fear of cancer recurrence and other topics surrounding that. I want to thank our panelists here tonight, the Yale survivorship team, Maura, Angela, and Scott for taking the time out of their night to talk with all of us. And we hope you'll join us next week as well for the Smilo Shares event. That's going to be Shopping Savvy for Survivors, Eating Healthy on a Budget, and seeing how nutritionally minded our group is here tonight, I can imagine that there's going to be a lot of repeat participants next week too. So we hope to see you there. I want to thank everyone again. See you next time. Bye.